Okay, welcome back to my channel. And today I'm so excited because I have a friend, a colleague, and this is why I love these podcasts because I get to catch up with these specialists and experts around the world. And today we're going to meet retired Captain Darren Couture. So let's dive right into his bio and you're going to see why you're going to sit through this podcast. Meet Darren Couture, CRNA, U.S. Navy Captain, retired. In today's video, we're going to sit down with Darren and a certified registered nurse anesthetist whose unique career has spanned from serving our country as a U.S. Navy medical officer to delivering expert anesthesia care in civilian practice. A snapshot of Darren's journey, you'll see that he had education as a BSN from St. John's University School of Nursing in Minnesota, and then he is a master's in nursing in nurse anesthesia training at Georgetown University through the Navy Nurse Corps anesthesia program. He also has a doctorate, a PhD in nursing from the University of Maryland. His military service spans a very proud service, and he's a retired captain bringing discipline and precision from the deck plate to the OR. He is an expert in regional and general anesthesia and in patient safety advocate, educator, and mentor. Darren, thank you so much for joining me. How are you doing?
I'm fantastic, Dr. Doan. It's so great to be here and see you. Thanks for interviewing me today.
Likewise, and I noticed that you have quite the robust beard once you left the Navy.
Yeah, I haven't been able to grow facial hair for like 29 years, so I finally get to see what it's like.
When I was on the ship on the carrier, you know, the CEO actually approved having beards, and it was like everyone's so excited. So everyone got a like no shave chit, and it was you know, people were so excited.
I mean, there are beards, and then there are beards that go the extra mile.
And so, okay, so you've gone from serving in the U.S. Navy, delivering life-saving care as a CRNA. That's an incredible journey in itself. But what inspired you to become a nurse and then also to become an officer in the Navy? Can you walk us through that?
Yeah, absolutely. That's a great question. Really, I think it started pretty young, actually, for me. I had grandparents growing up that were, going through health issues and in skilled nursing facilities in the hospital. And so I witnessed that pretty early, the healthcare, and sort of what they had to deal with and endure. And I think it was probably the age of like 12 or 13, I kind of felt this like sense that I needed to help, like I needed to do something and I wanted to be able to provide care, and so it happened early. And when I was in high school, I was sort of contemplating career paths and like, what should I do? Where should I go? What should I become? And I had the benefit and the blessing that I had an older brother that was 10 years older than me, and he was a registered nurse. And I had initially thought that maybe I wanted to do something like maybe be a physician or a physical therapist. And he somehow knew about this path and said, hey, why don't you become a nurse? There's so many different things that you can do. You can specialize in whatever you want to. And he mentioned this career of going in to be a nurse anesthetist. And I didn't even know what that meant at the time, but I was like, hey, it sounds interesting. Like, well, I'll do that. So I went to, undergrad. I pursued a nursing degree. I got a job initially out of nursing school. This was a long time ago, back in 1995. And I kind of had a difficult time. I knew the path that I had to take. I needed to become a critical care nurse. I needed a job in a hospital, in a critical care setting, either an emergency room or an ICU. And I had a difficult time finding work, like finding that path. And because there was a kind of a surplus of nurses at the time, I went to a job fair, a science related job fair. And there was a Navy Nurse Corps recruiter there just by happenstance. And I met Lieutenant Dixie Ani, who's now a great friend and mentor of mine, also a retired Navy captain. And I got recruited into the Navy. And she said, like, I don't know if you're going to get the experience that you need, but we'll put you in a hospital. We'll put you to work. You'll definitely get there. And what I realized after joining the Navy was that they had their own training pipeline. They had their own program that went into Georgetown University. And so, along with that decision came this blessing that I could just go right into it through the Navy and pursue that training into the Navy.
Can you explain the rank structure, I mean, in terms of like, for officers, what the ranks are?
Every branch service has its own sort of rank structure. The first, like, lowest grade officer in the Navy is an ensign. That would be an equivalent to a lieutenant in the Army or the Air Force. And then it's a lieutenant junior grade in the Navy. That's an O2. That would be the next level. And then a lieutenant, which that's an O3 in the Navy. That would be like a captain in the Air Force or the Army. Lieutenant commander is an O4, and that would be like a major in the Air Force or the Army, and the Marines, actually. And then O5 is a commander, which would be a lieutenant colonel in the Air Force, Army, and Marine Corps. And then Captain 06 is a colonel, like a full colonel in the Air Force, Army, and then of course there's flag officers, admirals, generals, and that starts at the 07 level.
Thank you. And so that's a big deal. So you made 06 and you're retired, but now you're also an anesthesiologist, or actually a nurse anesthetist.
Yes.
I kind of, you guys are the same, do the same things, right? So people say that they think that anesthesia is going under for surgery. Okay. So what are the misunderstandings that people have about CRNAs and what they can do?
That's a great question. Really, we kind of, for a little while, prided ourselves as like we were the best kept secret. Like, not too many people knew about nurse anesthetists. And I still think a lot of people don't. It's interesting that you've sort of interchanged these terms of nurse anesthetists and nurse anesthesiologists, because right now our society is going through this change where we're now more and more people are referring them to themselves as a nurse anesthesiologist, because we are true professions of anesthesia. We're true professionals. So yeah, we were kind of not known. And again, like I mentioned earlier, it's still not known. What a lot of people, I think, don't understand and maybe don't know is that about 75% of the anesthetics that are delivered across the country today, there's a nurse anesthetist, there's a CRNA delivering that anesthesia. And that can mean different things in different states. We have different practice guidelines and supervisory guidelines. So in some states, there's now, I believe, 39 states that we practice independently. I function just like an anesthesiologist. I do the same job as an anesthesiologist. But there are some states also that practice under a supervisory model. And a lot of anesthesiologists and CRNAs refer to that as a anesthesia care team model, where it's physician-led. And that can mean that they are there for key points of the anesthetic during the induction or when we go to sleep, and during emergence when we wake up, and critical key times during the anesthetic. So it just depends on what state you're practicing in, what hospital you're practicing. In the Navy and the military, we use CRNAs, we use nurse anesthetists to function independently. So we deploy, we go on ships, we go operational, and we do that job, and we do that role of providing anesthesia care to the warfighter independently, completely independently.
Yeah, I was the senior medical officer on one of the carriers, and we had a CRNA deployed with us. And then I just had surgery recently, and the ENT surgeon came up to me and said, you need to pick Doan or ask for Doan because Don's the best, and he's a CRNA. And so, he's been doing this for a while. So, and I was fully, basically put under for surgery, and everything was smooth. And so you're right. And I actually have a friend who is a medical recruiter, And he says that right now CRNAs are in such high demand because they are independent providers. And as your field is kind of pushing you towards more of a independent role as a nurse anesthesiologist, but you're a little bit less expensive than an MD. But they're asking for like 500,000, to pull a CRNA into a major, surgical center. So, are you seeing that kind of demand right now for CRNAs? For those who are just looking at this as maybe, hey, is this a field I might want to go into?
Yes, absolutely. I think anything in medical care ebbs and flows a little bit of sort of what the need is, but there is certainly a greater need, as the baby boomers get older, as we see patients, and people living longer. Certainly surgery and anesthesia are in high demand. And so, yeah, it's a fantastic field. There's to become an anesthesiologist is lucrative in its own right, and it's a great path to go down. But I think, becoming a nurse anesthetist is certainly in demand. It's a great profession. I can't speak anything bad about it, honestly. I can't say anything bad.
So you've managed high pressure situations in the combat zones as well as in the operating room. Okay, so what experiences, how are these experiences compare? And then what skills carry over between the two?
I think there's a lot of similarity. I mean, anytime you get into a high pressure situation, the stress level gets up, your heart starts pumping, that adrenaline starts going. You certainly can see that in combat. You can certainly see it in the operating room. We certainly do see it in anesthesia. And so I think it's all interrelated. And, how you deal with that in the moment is certainly critical. How you manage that stress, how you deal with that stress is certainly a critical thing. And I think that, to be effective in those moments, I think you have to have experience. I heard a surgeon say once that experience is a difficult teacher because she gives you her test before she gives you your lesson. So experience comes in that. But, being able to manage that stress and be effective is key.
Very interesting. And talk about stress. Many nurses feel overwhelmed about going back to school for additional training. What is the hardest part that you experience as a CRNA in training, and how did you get through it?
I think the hardest part for me was the time and just the amount of information. I didn't realize it. And, people that were senior to me, people that were helping me through this process and mentoring me to become a CRNA, they try to talk about how the time and the amount of information that you're going to come up against and be pushed to learn and know and process. They talk about it, but you don't really understand it until you get there. And so the amount of time, I remember back in my day, now there are sort of limits on how much clinical time, how much didactic time we can do in a certain day, but those limits weren't there. Maybe you experienced that when you were going through residency as well, but there were not limits. And so the amount of time that I was anticipated and expected to be in the operating room on any given day could be long. I remember days in my trauma days that I worked almost 24 hours straight, like just going from case to case to case. And so the amount of time that went into it was unbelievable. And then the vast amount of information, again, we were, again, you probably experienced this, I'm sure, in medical school. That first year is just vast amounts of information that you have to process and learn and know and commit to memory, and that, I think, until you experience it, I don't think you can really be ready for it. Is it doable? Absolutely. I mean, I think what gets people through it, what got me through it, was to love what I do and be really committed to what I was doing. I really wanted this. So that time commitment became sort of easy and second nature almost, because I just loved it so much. Yeah.
Yeah, it's a little bit better now in medicine because of the 80, work week rule,
Yeah.
or 80-hour work week
Yeah.
rule. And you're right. When I was an intern in the ICU or the intensive care unit, I spent probably 110 hours a week.
Yeah.
And we had 3 days off a month. I remember that. And so we had, like, for example, a snowstorm, and my wife was like, I need to go get a haircut because you've only had, like, one day off in the last 2 weeks. And she went out in this blizzard, and then a police officer returned her back to our house like 10 minutes later because she rolled the car and totaled it in this blizzard in Iowa. But that's kind of stress that your family goes through. And you don't know until you go through it that basically this training is causing all this strain. And you don't find the benefit until, like, later on in your career, right? Like, you're a senior CRNA, I'm a senior ophthalmologist now, and it's easier because we're making more money, we have more time, we have more ability to spend with our, spend time and travel with our families. So it is worth it in the end, but it is very grueling. And thanks for being honest, because for those who are considering it, they need to know what they're getting into.
Yeah, absolutely. Yeah.
Yeah. And it's also interesting. One of my patients just informed me that Johns Hopkins went away with or did away with their nursing program in terms of the BSN program. You can only get a master's in nursing. You can only get, like, a doctorate in nursing now. So they're pushing this field into exactly what you have become, which is a doctorate in nursing and then CRNA. Yeah. Is that interesting?
So they made their entry level into nursing a master's level.
That's right.
Is that what?
That's right. And their master's level is only in preparation for advanced career in nursing.
Yeah, that's interesting.
Yeah. Okay, so not all leadership happens from the front of the room. It often happens in the trenches. Can you share a story when that made a difference, where not being the surgeon of the, the sole responsible individual for that surgery, where your leadership and your medical knowledge mattered? Can you give an example for us?
Yeah, absolutely. I mean, I think this goes back to, like, how you manage your stress and how you manage yourself in those critical situations, right? And again, it is all related. I can think of several instances where, whether it's in a surgery, where stress levels get high, patients in a critical situation, maybe they're losing blood, the surgeon's kind of losing control on what's happening in the moment. And I think what makes in those moments, I think what is the most effective thing is for somebody, and I've had to do this, like, to kind of take charge and when you feel the stress levels get high, when voice levels go up, when stress levels go up, people react in that, and it tends to make things noisy and chaotic. And I think that's a detractor. So I can, say on several occasions, I've had to just take control of that situation and say, hey, everybody just needs to take a deep breath, relax, maybe tone down the level of, like, you don't have to yell. You can talk to the person next to you and effectively communicate without yelling, and just sort of bring the stress level down. And I've had to do that on several occasions. And I think that's probably my way of dealing with stress, is to sort of, like, internalize, really think about what's the critical thing, what's the key thing, what maybe is the thing that's going to, not to be morbid, but what's going to kill this patient if I don't make this critical decision. So, and sometimes it takes that person to do that, to say, hey, everybody just needs to slow down, take a deep breath, and think, and be in that moment instead of just letting the situation overwhelm you. Does that make sense?
Absolutely. Yeah. And then, the next question I want to ask you about technology, because, with AI is coming and all this other stuff with advanced technologies in the field. So how is that going to affect CRNAs, in the future, do you think, and anesthesiology in general? Mm-hmm. I mean, are we going to have robotic anesthesiologists? Are we going to have, like, ChatGPT administrating medicines and pushing meds?
It was about 15 years ago that somebody, I'm trying to think, I think it was a GI doctor, tried to introduce kind of like an AI anesthesia provider. They called it SED assist, like sedation assistance, and they tried to use this sort of computerized algorithm to deliver like heavy sedation to GI patients. I can tell you that it didn't work very effectively. I think that patient care is so dynamic. I'm sure you can understand that things change in the moment in a split second. And while computer generated programs and AI, I think could adapt a little bit, I think you're going to need people there to interact and to because I can say many times in my practice, and I'm sure I'm speaking for a lot of people that would sort of corroborate this. It's sometimes it's instinct. It's like you can sense things happen before they occur. I mean, it's like an intuition, and probably goes back to that experience. And I don't know if a computer is going to be able to suss that out. I don't know if a computer is going to be able to sense that. Things that occur before the impact, before the before that critical moment. So I think you're always going to need people in there. But anesthesia, we accept technology. We have to. I can remember in my practice, things have changed a lot of how we do things like regional anesthetic. When I started, it was we used a peripheral nerve stimulator, and now that's kind of an archaic thing. We use ultrasound, so we use technology to improve our practice. Maybe AI will help. I don't think it'll ever replace. I hope it won't ever replace.
And if it does, we'll be retired by then.
That's right.
So obviously, for patient safety purposes, you're saying that it should be, person to person type of interactions. Okay. Mm-hmm. And in a surgical situation, you only have moments to build rapport and trust with patients. What's your secret? Aside from your handsome, demeanor and your very furry face right now, what other, methods or pearls of wisdom that you can share about building that trust just moments before a patient goes back to the operating room?
Yeah, that's really critical. And you've hit it really on the head, that I have probably 5 or maybe 10 minutes when I meet that patient in the morning or in the afternoon. Oftentimes I've reviewed their record, I've seen their brief history and what they come with as far as medical conditions, but I get a very brief amount of time to interview that patient, to consent them for anesthesia, sort of develop my plan in my mind based on their medical history, but to develop that rapport and that trust. And I've never taken that lightly. And I think that's probably the first key, is that you have to understand you're bringing a patient through a really stressful point, maybe the most stressful point in their life up until now. Maybe they've never had anesthesia before, they've never had surgery before. And so they come to the table, no pun intended, stressed and maybe in a worse place that they've dealt with before. So I have a very short amount of time to develop that rapport. I think for me, I definitely take every patient differently. I don't have a secret formula. I don't say, because not every person's the same. So I have to very quickly, when I enter the room, see what their demeanor is, see what their eye contact is, see what their how they're relating in all the situation. Maybe just ask them a few brief questions. I introduce myself, of course. I get to know who they are, what's their name. We have to do that for HIPAA, right? But very quickly, I have to gauge, where's their stress level, where are they coming from, in terms of how they're handling this situation. And so it's different for everyone, but it might mean that I have to be very calm, soft-spoken, deliberate with my words. Confidence, I think, helps, mm-hmm. And that comes with experience. But coming in confident, maybe I need to crack a joke. Maybe I need to make light of the situation. Maybe I just need to tell them that they're going to be safe and that I have them. I'm going to protect them. And there's no secret sauce for it. It comes with experience. But I think the key, I think some of the keys are what I've mentioned, being confident, being, assertive.
Yeah, that bedside manner is definitely an art that you pick up.
Yeah.
And you learn from other people, right? Because I learned from my attendings how to approach people. And when I was a student, I was just a stupid, thug, right? Who just basically want to say whatever I want to say. But then you learn, like you said, what do you hold back? What do you share? Some people want to joke. And I love that. Reading the room is so important. But
100%.
But you give some magic juice, man. So when I was in surgery, right before, they gave me some, I think it was Versed to kind of get things going. I don't remember anything from that point all the way to the operating room. The next thing I know an hour later in recovery, do I have any recollection what is going on?
Yeah, we jokingly sometimes say if we've done our job correctly, you don't remember much. I've done.
That's right. That's right. So burnout in healthcare is a real thing right now. The suicide rates are up in healthcare providers. People are burnt out and depressed. Just things are just terrible. You and I tend to have this happy-go-lucky demeanor, right? And I've known you for a long time, and you've always had that demeanor. So over the years, what have you done to help counteract that burnout? And what are you doing now currently to, have that work-life balance?
Yeah, certainly. It's important in our role. And we take this very seriously in the practice of anesthesia. And it was stressed when I was a student because burnout and drug diversion is a big thing for us. We have access to substances that, can be very harmful if you use it in the wrong way. Using it in a surgical situation certainly, is safe. But if I use those substances for a non-surgical situation, that would be a bad thing. So we take it seriously, and sort of burnout goes along with that. I think for me, my faith, my belief in Christ has always been a center for me. And I think that's what you have to do, is find that center for you. It might be your faith. It might be religion. Maybe it's just taking that moment to breathe and relax. I think you have to find humor in it as well in healthcare. I think you can't. It is a very serious, and I don't mean to make light of it, but you do have to laugh a little bit. You do have to sort of take the moments to realize it is very serious. But I think if you just go at it from that level, the burnout is going to be so much quicker and and more prevalent. So maybe laugh a little bit, smile a little bit. I think, again, going back to my faith, I realize that much of what I do is beyond my control, and I can only control how I react in that situation. So if I can react in a way that's calm and not stressful, I think that makes me centered. So those are some of the techniques that I've used. But yeah, you have to find what centers you. I think when you come home, you have to let it go. You got to release it a little bit. Maybe you need to talk about it with your spouse or with a mentor or with somebody else to sort of debrief and let go of that stress and let go of that anxiety. And find whatever centers you at home. I try to exercise on a routine basis if I can. You try to eat healthy and do all those things that keep you healthy. So yeah, it's like you said, it is a work-life balance. It's being able to sort of balance that stress level and find out what centers you at home, and I try to do that when I do get home. Yeah,
that's awesome. For me, YouTube is fun because I get to meet new people and also talk to old friends and stay in contact with colleagues around the world. And so it actually is fun. It's like it's stressful, leading up to it because you have to set up everything and do everything yourself, and camera and video editing. But you're right. You have to have this work-life balance and something that's just beyond what you do on a regular basis, because taking care of patients, is draining. I mean, we're dealing with life and death situations. We're dealing with people with terminal cancers or life-threatening cancers too. And then we're also dealing with, people who are losing, eyesight and limb and organs, and, their health is deteriorating. So we need to be recharged in order to take care of those individuals.
Yeah.
So looking back, what's one moment that affirmed that you made the right choice? And what is one single thing that you would give advice to other nurses who's just starting out in their career?
I don't know if I can single it down to one single moment, but I can say, looking back at my career and what I do from a day-to-day basis, there's always something that happens. If I can, I mentioned earlier, if I, this is a stressful time for patients, if I can make that moment easier, if I can put a smile on that person's face, if I can put them at ease, if I can be that person that takes them through that stressful situation, I know that I've made the right decision. I mean, nursing as a whole, medical care as a whole, anesthesia as a whole, sometimes isn't gratifying. Sometimes you don't get the accolades from a person. Sometimes you don't get people say thank you for what you do. You don't always get that, but I get it from knowing that I can bring my patient through that situation. And when I drop them off in the recovery room, maybe they're not going to remember my name or my face, but I know that I've made them comfortable and less stressed, and I brought them through that whole process effectively and safely. I'm gratified with my job, and I know I've made a difference in somebody's life. And so it's not one single thing, but it's every day. I mean, it really is every day.
Yeah, that's so good. And then what one piece of advice would you give for nurses starting out? What would you say to them to help them with their career and to find that final pathway for their choice?
Stay the course. I had to teach that to myself. I'm not going to say my path was easy. There were times when I was in nursing school that I thought, what have I done? I have made the wrong decision. I can't say that it's all been easy, but you have to stay the course. I've met obstacles, and that's, difficulty in school, tests, papers, that kind of thing. Just the difficulty of the day-to-day, stress of school and the job. I've met obstacles in other people who say, like when I was a junior nurse in the Navy, and I knew I wanted to become a CRNA, I had people say, you're too young, you don't have enough experience yet, you need X, Y, and Z first. I just took that information politely and said, yes, sir, yes, ma'am, and kept moving. And I think that's what you have to do. You have to have that inner drive, that inner resilience. And I think that goes a long way. So you really have to just stay the course. If you're really focused on what you want to do and you're sure that that's what you want to be, you'll get there, but you got to keep moving. You got to keep working.
That's awesome. Thank you so much for joining us today, and really appreciate you. And just want to remind our listeners and our viewers that if you like this video, please like, share, and comment, and also hit the subscribe button so that you can get notifications for our future podcasts and videos. Thanks so much, and have a wonderful day.